Yay! So welcome everyone. This is Melissa from the Wellness Centre at Proserpine, and I hope you have your morning cuppa ready. I have mine. And this morning, we've got Julia joining us. And Julia is also a traditional Chinese medicine practitioner. She's based in Melbourne. And so I'm really happy to have her join us today because she has this passion for pregnancy care and for birth preparation and labouring, and then also this special period of time that we are very familiar with in Chinese medicine, which is the 4th trimester. So join us for the next couple of half an hour or so, and we're going to have a really lovely chat. So Julia, thank you for joining us.
Thank you so much for having me, Melissa.
Yeah, so tell me a little bit about, you also have an online program as well, so we'll talk a little bit about that later, because at the moment, it is a very challenging time if you are pregnant, because of some of the restrictions in relation to COVID-19, that a lot of women who are pregnant aren't able to access their usual care.
Yeah, we've noticed that with a lot of women, and we were actually lucky because we had it ready to go just before COVID-19 actually came out. And as well as COVID-19, we designed the Fitfor2 program because we actually noticed that there's a lot of women, like regional and also in the metro area, that weren't getting the level of care and support that pregnant clients need, and even post-birth that they require as well. And there's a lot of different information out there, and it's really hard for pregnant women to decide what is really important and, you know, who's right, who's wrong, what information do I listen to. So another midwife, myself and a lactation consultant got together and had a chat about how we can help these women. And our basis is that we want to empower them. We want to give them the knowledge, but also that empowerment and that feeling that they can do anything. You know, like, pregnancy is a wonderful time. And we also wanted to give them the support as well, and let them know they're not alone, and that by finding their village before they actually give birth, and you know, having a safe place where they can ask questions as well and get all of the education that they need. So this is in regards to what's happening during a pregnancy, correct exercise, correct nutrition, you know, so that they're getting all of the information that they need throughout their whole entire journey. But we don't just leave it there. We also look after them once they've given birth as well for the 12 weeks after, which is called the 4th trimester.
That's such a comprehensive program. That's quite amazing that you have come together and have a team of people. And I love what you shared about, you know, needing a village, because we are lacking a little bit of that these days. I feel like women can feel quite isolated, and that can bring a whole host of concerns for them. And for some women, it can exacerbate their anxiety, because pregnancy, there's so many changes on a daily basis, it seems.
Yeah, exactly. And it's really scary because 5 out of 6 women are actually suffering from postnatal depression as well. And we're finding that this is more because we are so isolated, and also because women are so used to, because they are having babies later, they're so used to having, you know, their life and their socialization and work. And then when they give birth, all of a sudden they don't have that. And, you know, they're at home with the baby and they can lose track of who they are as well. So this can all exacerbate and lead to postnatal depression. But by having a village or other people that you can reach out to, it means that we're not isolated. And by having this program online and the supportive Facebook group, they know that they've got people that are there that are going to read it, and they've got other mothers that they can access to as well, and they can read other mums' comments and what other mums are going through, and understand that you're not alone. Everyone experiences the same thing, and we're all here to support you. So it doesn't matter, you could be in America and still be in the Facebook group, and we can still give you that support and, you know, virtual hugs and advice that you need. So
that's really beautiful. That's really beautiful, because for the women in my community here in Proserpine, a lot of them have partners who do return to work, and their partners often work away in mining communities. So there is that interim period where they often will have family come to support them immediately after the birth and for the first couple of weeks. But then once their immediate family may have to leave and their partner goes back away to work for 7 days or 7 nights, then the women are left for this duration of time. So I feel like this is such an accessible program. And I love how it is also other mums pouring in their wisdom and also having the access to the health experts like yourself. And who are the other health experts that you are part of the program?
So we have Anita Guerrera. So she's a midwife, but she's also a pregnancy and postnatal fitness instructor. And she's also part of the Baby and Beyond body empowerment. So that's empowering you to love your body after having a baby. And there's no such thing as your pre-baby body. And then we've got Kelly Eason, who's a midwife and lactation consultant, and she actually specializes in lip and tongue ties as well. And then we have a couple of osteopaths. So we have Emily Jones, who's an osteopath as well, and she deals with pregnancy and postnatal conditions and also children as well. So she treats children up to the age of 3. So it's really important as well that once you've had a baby that you do go and take your baby to see an osteo or a chiro, because quite often what happens is that they're so packed up in the womb, and when they give birth they can quite obviously have cricks and everything in their neck, which can cause reflux, can cause digestive issues, and can make them quite cryy, windy and uncomfortable. So it's really important that like a week after giving birth or when you can, contacting an osteo or a chiro to have the baby looked at, and just making sure that their neck is in good order, and that there's some people can have shoulder issues as well, and that can put the digestive system out as well. And because obviously babies can't talk, their only way of communicating is crying. Yeah. The osteos can also help along with Chinese medicine, like for any reflux issues and all of that, just by stimulating the spine and loosening the muscles to get the diaphragm working, because quite often if the diaphragm's quite tight, it can lead to silent reflux. So, and that can cause a baby to just be crying constantly because obviously they've got the reflux coming up and they're uncomfortable, yet we don't know what it is. So
wow. That's a lot of, that's so helpful. Tell me a bit about, because a lot of people may not know that Chinese medicine is actually very useful through all these stages of pregnancy prior to birth. Most people know it mainly for things such as a breech presentation. I get recommendations from midwives for patients to come and see me at that time, or usually like a week or 2 before for birth preparation. But yeah, please show me some more information about how Chinese medicine helps.
Okay, so basically Chinese medicine can work throughout the whole entire pregnancy. So I work with preconception work as well. So I always tell my clients, once you get pregnant, your journey doesn't end there. It's like we like to see you throughout your whole entire pregnancy and postnatally as well. So during your first trimester, basically we recommend that you come and see us once a week until about 14 weeks. And what we're doing is we're doing acupuncture to help boost your body up, but also to try and reduce the risk of miscarriage as well. So a lot of people don't talk about this, but miscarriage is quite high. So we're using the Chinese medicine to support and reduce the risk of miscarriage. So we do points which we call the baby points, and holding a pregnancy, and we also give you herbs as well, which is called holding the fetus formula. So they're really nourishing herbs which help to keep the baby in the uterus, and also to support you as you're going through the different changes as well.
It's like providing the ultimate environment for the baby.
Exactly. So we're working on the kidney energy, so supporting that kidney energy, and also supporting warmth into the uterus, because a baby doesn't want to implant into a fridge. So we want to make sure that lower abdomen is nice and warm and getting all of the blood, all of the oxygenation, etc., so that you can grow the baby and the placenta. Because during the first trimester, you're not just growing a baby, you're growing a whole different organ as well, which takes a lot of energy. So I
hadn't thought about that, but yes, definitely. Organs and systems and the brains.
Exactly. So as women, we're very lucky because, we can grow a whole new organ from scratch, which is the placenta. And so that's why women can feel quite tired during the first trimester as well, because all of that blood and energy is actually going to the uterus to grow the baby and the placenta. So as well as focusing on reducing the risk of miscarriage, we can also assist with sleep issues. We can also assist with nausea. So morning sickness is really good. So my sister-in-law, Deborah Betts, has got a couple of really good points. So not just using the wrist ones, because I find that sometimes that doesn't always work for women. But we use different points along the kidney meridian, which helps get that energy refocused and regoing, and it can really assist with morning sickness and nausea. Also sleep issues. We do find that women in the first trimester have sleep issues, so we can help with that. We can help with reflux, loss of appetite. So there's lots of things we can help with. Also the cramping that you get during that first trimester as your uterus starts expanding.
Sometimes women get very concerned about that sensation as well.
Yeah, and it's just explaining to them it's nothing to worry about. It's just a uterus expanding and growing. It's a muscle. So we can put points in for muscular pain as well. And also it's individualized. So whatever the woman is going through, we will always treat to what is going on with her. And then during that first trimester, you will have that basic formula of holding the fetus, but we can add in different herbs as well and different supplements. So depending on what's going on, and one of my favorites is Epsom salts, because, you know, it's available in every supermarket, and soaking your feet in that is magnesium, which actually helps sleep and helps to relax muscles, and is great for stress and tension and anxiety.
Oh, beautiful. That sounds so nice. That would be really lovely for women to also begin to lessen their anxiety, because often at this time, women are still carrying on with their everyday, very busy lives.
Yeah. So I get all my clients just at the end of the night just to either have a bath or just do a foot soak. So, and then we get them into good habits ready for the third trimester. So throughout the second trimester, as generally I get them to come in about once every 4 weeks. So as long as everything's going really well. But during the second trimester, again, we're focusing on just boosting the mum up, making sure that she's getting enough energy, focusing on reinforcing kidney energy. You can get a lot of different aches and pains during the second trimester. So we can get pelvic instability, we can get sciatica as baby starts getting heavier. So we focus a lot on relieving those pain issues as well. I generally send them home with some stretches, again, making sure that they're using the Epsom salts, making sure they're taking a magnesium supplement as well. And then I do find in the second trimester, sleep can be an issue and anxiety comes up quite a bit. So whenever I see my female clients, I'm always working on stress and anxiety in the background and boosting them up, and just, you know, giving them reassuring them as well that it's all perfectly normal, a part of pregnancy. So, and then third trimester, again, if there's any, as baby's getting heavier, you're putting a lot more pressure on the lower back. And we do find that there's quite a lot of hip issues, pelvic pain as well, pelvic instability. Some people can feel that their legs are quite tender. You start getting neck and shoulder stiffness, more fatigue as well. So we can assist with all of that, and underlying all of that, we're always supporting them as well. So just, you know, supporting them, emotionally as well. And then at 35 weeks, we start birth preparation. So what I get them to do during that time is come in one-on-one, and I go through the acupressure points, how to do it. And then they will see me once a week. Once we get to 40 weeks, I might up it to two appointments a week. But I get them to do the acupressure themselves as well. So what we're focusing on with the pre-birth preparation is not actually getting the baby to come, not focusing on the woman going into labor, but actually preparing the body. So building up her energy, her kidney energy, building up her blood and building up her yin, and just making sure that we're getting the right nutrition, and just preparing the body to go into labour naturally itself. So we also focus on ripening the cervix. So that's actually loosening that cervix so that it becomes thinner and then it can dilate a lot better. So there have been numerous studies done that women who have actually done the pre-birth preparation have a shorter labour and a quicker labour. So, and I've just had one of my ladies who is aiming for a VBAC, which is a vaginal birth after a C-section. And she laboured in 4 hours.
Wow.
So 3.6 kilo baby.
Beautiful.
So she got her wish, and 4 hours and second baby, and she's absolutely astounded. So in the third trimester, we can work on breech babies as well. So breech presentation means that baby's not face down. It can be transverse or sitting with its bottom down and its head up under the rib cage. So moxibustion is used for a breech presentation. So generally what women will do is come in, we'll do the session, I'll show them how to do moxa, and then I send them home with a moxa stick, and they need to do that for 10 days consecutively, 20 minutes on each side of their little pinky finger. And what that does is just send warmth up to the nutrients, and it's a specific point, bladder 67, which is used in Chinese medicine, which is to reposition a baby when it's in the wrong position. So we say null position of the fetus. So it can be used to help with a posterior baby as well, but we also have acupressure, an acupressure routine which you can do to help change a baby's position from posterior to anterior as well. So I've actually worked with a couple of women this year who had posterior babies. They were doing birth preparation with me. I do the points for the posterior position and get them to go home and do it as well. None of the babies were moving, but as soon as the women went into labour, they did those points, and babies flipped. So I had three women all at the same time, and I was like, what am I doing wrong? But as soon as they went into labour and they actually did those points, all 3 babies flipped, and basically the longest labour out of that was 8 hours. The shortest was 2.
Wow. That's a signal. They get
a
signal, and then when that moment of action comes, baby knows what to do. The body knows what to do.
Exactly. And they're like, oh my God, I'm going to need a C-section. I'm like, look, just keep doing it, you know. And all 3 babies flipped. So
wow,
which is amazing. And then I also teach them acupressure points for as soon as they've given birth to help bring the milk in. So basically, as soon as mum's given birth, it doesn't matter whether you've had a C-section or whether you've had a normal birth. I get the birthing partner to come round, and what you do is you actually press gallbladder 21, which is up here on the top of the shoulders, midway. And what that does is it actually creates that letdown process to go on and helps bring the milk down into the tissues. So doing that one. And then if you've got after birth pains, one of the points that we use is spleen 6. So we use this in the pre-birth preparation as well. But if you find that once you've given labour, you've got pre-birth pains, or you're getting pain when you're breastfeeding, if you actually just put pressure on this point, that helps with that pain as well.
Wow. Are these acupressure tips included in part of your program online that women can review them?
Yep, so they're all included in the Fitfor2 Pro. So there's acupressure tips, and we've also got the birthing preparation course, and it's all covered in there. Or if you want to put on your site my details, I'm happy to send them out a 23-page acupressure booklet, which they can read, and I can always go through it with them online as well.
Fantastic.
So I just really want people to understand that acupressure can assist and get it out to as many women and birthing women as possible. So.
And it's so accessible. Like acupressure is something that you can find time to do, and like you say, just doing it a couple of times a day or when you have time during the day really can make a difference to the overall presentation of birthing and post-birth as well. Let's talk about the 4th trimester. I love this time. We talk about in Chinese medicine because it's part of Chinese culture as well, and it's really getting momentum at the moment.
Yeah. So in the 4th trimester, so from a traditional Chinese medicine point of view, it's called the golden month. So although it technically it's meant to be for 40 days. So the golden month means that basically for those 40 days, you're not meant to leave the house. You're not meant to be going to numerous appointments, etc. You're meant to be focusing on yourself and on bonding with the baby and just on resting and recovering and forming that bond with your baby and nurturing that baby. And what happens is it's up to the family to come in and look after you because you've actually grown this baby for 9 months and now you're nursing, if you choose to nurse, that is. And it's all about focusing on you in recovery. So making sure that you are getting rest, making sure that you're not doing housework, that they come in and do all the housework, the cooking, the cleaning for you, so that all that you need to do is focus on making sure that you're eating, making sure that you're getting lots of water and just feeding that baby and looking after the baby.
It's a very different concept to what women are used to. It can be quite challenging.
Oh, it's a huge different concept. And I get many women saying, oh, the baby won't, sleep in its bassinet and what's going on? And I'm like, well, this is part of the 4th trimester. The baby's been inside you for 9 months. It's used to hearing all the noises, your heartbeat, the digestion, etc. And I know for my girls, they'd only sleep for 20 minutes. And with my first, she wouldn't sleep in the bassinet or anything like that. So I learned she'd sleep on me, but she didn't want to be in the carrier. So I'd literally go and get my snacks and my drink bottle, which was 750 ml, set up to feed. And if she fell asleep on me, she fell asleep on me, and I had the TV controller in my hand or a book next to me, and I just sat there and let her sleep on me, because as soon as you moved, she'd be awake. So
a lot of mums can relate to that.
Exactly. So it's just letting you know, I know there's a lot of books out there, like that they should eat, sleep, play, or play, eat, sleep. It's like every baby is different. And, basically my advice is throw the books away, do what is best for you. And if that means you need to go out walking them in a pram to get them to sleep, put them in the car to get them to sleep. If they need to sleep on you, that's what it is. And I know that for the first 7-8 months, that's what I did. So, and it's like, no baby's the same, and you've just got to do what works for you and not let other people tell you, well, I did this and I did that, because this can create fear and over analyzing, and oh my God, I'm a bad mum because my child doesn't do this or doesn't do that. And please don't compare what is going on for you compared to other people as well, because by doing that we create anxiety and fear. And we can start berating ourselves and really undermining ourselves.
Yes.
When you know what's best for your child, and just go with what is best for you and your child, and don't listen to anyone else, is my best advice.
That's brilliant advice. It's so helpful. It really is. And also we're talking about this golden month is really important, even not just for the bonding between the mother and the baby, but for the mother's health as well.
Yeah, so from a Chinese medicine point of view, during this time we have the chance to actually enhance our health. So by eating the right food, really nourishing food. So Chinese medicine is huge on congee and prenatal congees. So I used to do the ginger and chicken broth, and you can add in the eggs, and making sure, because the ginger helps for digestion as well. And the congees are actually really nourishing because they're really easy to absorb. They absorb quickly and they give you energy, but it's not hard on the digestion. So this way you're giving yourself nourishment, and the rice is actually really good for producing breast milk as well. So it works in tandem. So what we like you to do is focus on eating the right food. So that means warming food and actually eating. A lot of women forget to eat. Yes. So, making sure that you're having eggs for breakfast, and, or making lactation cookies, which have oats in them, which are really good for breast milk as well, and it all works on digestion. And by actually focusing on resting and recovering, we have a chance to heal any issues that might have been happening, or any deficiencies that might have been happening prior to the pregnancy. So it gives women a chance to actually enhance their health and make their health better by actually looking after themselves, eating correct, making sure that you're resting as well, getting enough sleep. And that means that any issues that may have occurred further on down the track can be negated by looking after yourself during these 12 weeks, basically.
Wow. it's such an important phase. I mean, I do remember in our family, my mum preparing a lot of food and preparing the broths for my sisters when they were just given birth, and checking in on them and making sure they're getting lots of rest and having that support for them. So it is vitally important. As you said before, women may, depending how the birth went and the experience, and then the exhaustion that happens afterwards, and then beyond the first couple of months, there can be a tendency where they may begin to fall in this postnatal depression.
Yeah. So the other thing I do find is like a lot of women want to know other women's birth stories. And I think, look, what happens with a woman's birth can shape what happens in the next year. But what I actually tell my clients is not focus so much on the birth. If it's been traumatic, we can help with herbs, different herbs and everything. And also the acupuncture can help with that trauma as well by calming the shen. So I'm always working with my pregnant clients on the heart and pericardium channels, because the pericardium is actually the keeper, or the gatekeeper of the heart. And a lot of women can get caught up and traumatized by their birth stories, which can actually affect bonding and everything as well. So if clients have had a traumatic or a particular bad birth, I do recommend that they talk to someone, whether it's their partner, whether it's a friend, or whether they go and see a psychologist. A lot of people don't know that after giving birth, you can contact the hospital as well to go over what happened at birth. And I do find that can be quite important for some women who need to express that they might not have been heard or what happened, just so that they can go over it and then help them to assist what happened and then move forward with that. So yeah, so I just wanted to let women know, if anything happens, they can contact the hospital and they can organise for an appointment to go over what happened during the birth as well.
Fantastic. This has been amazing. We've had a really wonderful chat. I've learnt so much. So Julia has this amazing program, which I'll post the links underneath this on Facebook. And she is available for telehealth consults as well. So you can contact her and organise a time with her to discuss whatever you may be going through and how she can assist you. She can also support you with acupressure programs, and also there's 4 programs. Is that correct?
We've got the Fitfor2 program. So that runs through all of the trimesters, and then the 4th trimester, and then we have the easy birthing preparation program and the 4th trimester program. So that's going through birthing from a midwife perspective, from Chinese medicine perspective, and then the 4th trimester is what to expect in the 4th trimester as well, so that you prepare for that before actually giving birth. So, and we cover the golden month and everything in that, and that includes the traditional recipes as well, and some certain supplements as well. So yeah, there's quite a bit in there.
No, it's such an amazing resource, and it's a resource that you can access in your own time and go at your own pace.
Exactly. Yeah, which is why we designed it that way.
Wow. Thank you.
You're
Thank
welcome.
you so much. I've really enjoyed hearing all of this information, and especially at this time where I know women are a little bit at loss of how they can get access to a team of health practitioners that can really assist them, and not being able to leave the house as often as they would like, and feeling that they can get support from reliable resources as well. That's really important.
Yeah, it is, especially at this time. And we just want women to know that they're not alone. There is support out there. And as well as doing the program, you also get access to a Facebook group. So you can post any questions in there. And within that group, we have all of us that wrote the program, plus an osteopath, a massage therapist. We've got women's health physios as well. So that can help with like your pelvic floor exercises and all of that after birth as well.
Oh, fantastic. And I just want to say, wow, did you say Deborah Betts is your sister-in-law?
Yes.
Some of us will know who Deborah Betts is. She's done this amazing research on maternity care. She's based in New Zealand. She conducts a lot of research on acupuncture, and she's definitely one of the experts, I'd say, in the world, researchers. And she has done so much to advocate for women's health in a hospital setting for birthing. So that's fantastic.
Yeah, so they actually get access to her book. So if anyone would like that book, just contact me and I will send you out the book and the cheat sheets, which you can take to the hospital as well.
Excellent. Hope there's a few local midwives. Hope they're watching this and maybe they can access that as well.
Awesome. That would be amazing.
Well, thank you so much, Julia, for joining us this morning. I really enjoyed this. So have a fantastic day. I hear it's quite cold in the Melbourne today. We're having a cold snap.
Yeah, currently pouring with rain. So.
It's still quite warm here, so I'm still a little bit sweaty. So I'll send you some nice warmth and heat.
That would be great.
Take care, and I'll see you next time. Thanks everyone for joining us. Bye.
Thanks. Bye.